everyone. Thanks so much for joining us. I have Leslie Eide live with me today, and we are going to be speaking about behavior in sports medicine. So, Leslie, please introduce yourself to our guests, to everyone, while I make sure that you guys can hear me. If you guys can hear me, pop a thumbs up in the comments and let me know where you are in the world.
Hi, guys. I'm Dr. Leslie Eide. I am a veterinarian and I do rehab and sports medicine. And my biggest passion is sports medicine and behavior that goes along with it. I'm also a competitor. So I compete in agility, and I've done that for almost 20 years now and very, very active in the sport. So it's my biggest passion.
Fantastic. I can see Alison is live with us. Thank you, Ali, for your thumbs up from Cape Town. And yeah, it's good to see you guys. So we are going to be running a bit of a competition during this conversation, and I'll let you guys know more about it as we keep going. But what I need you to do is I need you to post in the comments the name of our annual summit and to tag a colleague. And then you may stand a chance to win a 1-month membership to Online Pet Health. And that is fantastic. So let us know the name of our conference this year and who you want to see there, one of your colleagues. And yeah, you could stand a chance to win. So Leslie, let's go into behavior. So for me, I want to know how important is it to have like a really good, deep understanding of behavior when we're, practicing, not only in sports medicine, but also just in our normal consultations. Like, how much do we really have to know about behavior?
So I think it's extremely important. Now, what I'm going to say is I don't think you necessarily have to know like the names of all the theories and the concepts. Like, you don't necessarily need like the textbook kind of smarts of behavior, but I think understanding basic animal behavior, how to read animal body language, all of that is extremely important. And having both a plan in your head of how you deal with certain behavioral issues, but also being able to be flexible in your plan is going to be extremely important. Because while we might have all these theories of like, oh, this is how behavior works, this is how learning works, we also need to be flexible with what the dog is telling us is going on right in the moment and be able to change our behavioral plan on the fly to make it a better experience. I also really think behavior is going to play an important role in how well the dog recovers from whatever injury they might have, but also how they do in their treatment sessions. If they're always stressed out during their entire treatment session, they're not going to have as good a recovery.
Okay, so I think for myself, I'd love it if you kind of give a little bit of an example of what you're speaking about. So you've mentioned now that the animal shouldn't be stressed. So are we, when we're speaking about behavior, saying what are our patients' stress levels? Are they afraid? Like what are we looking to achieve when we say incorporating behavior into our consultations?
Yeah. So I think the first thing you should do is kind of start everyone on a level playing field. So don't expect a dog to just walk in the clinic and be confident and be like, yeah, I'm ready. I love everyone. I love what we're going to do. It's exciting. I'm happy to be here. But I also don't think you have to assume like every dog is going to be scared and fearful. So for me, a lot of what I do is observation. So, we learn about this in school. They'll say, the exam starts from the moment the dog walks in the door, because you should be observing them and seeing how they're interacting with the environment, how they're interacting with other people, what's their body language as they're walking in. So definitely observation can start everything going and start to give you your plan of how you're going to deal with this dog. But the other thing I'm going to do is also similar to my talks. I'm not going to assume anything about the owner or what like the owner is going to tell me about the dog, or even if the owner says something like, oh, my dog won't eat treats, I kind of am just like, that's fine. I'm still going to do what I'm going to do. And if I have to pick up 100 treats off the floor after the end of the exam, that's okay. I don't care. At least I tried. So practical kind of steps. I always sit on the floor to start the exam. I try not to be towering over the dog. And usually the way the room is set up, sometimes the owners will sit on the floor as well, but there are definitely chairs and stuff for them to sit in. And if the dog wants to hide under the chair, I'm okay with that. So I'm not going to force the dog to do anything they don't want to do. I'm going to try and use all my tricks to encourage the dog to start interacting with me, and then I can build from there.
Okay, so as you're observing the dog, obviously, you know, from our rehab perspective, we know what we're looking for. From a behavior perspective, what kind of things are you looking for in the dog? So you've mentioned now he's, you know, he might want to hide under the chair. Are there other like calming signals and things that you're looking for when you're just watching them and when you start to interact with them?
Yeah, a lot of what I'm watching is also movement based. So it does go along with rehab a lot. You know, in rehab, we're looking for gait changes and different movement changes. Well, I'm also looking for movement changes that might indicate more behavioral issues, or I shouldn't even say issues. I'd say just indicate emotions. So is the dog kind of slinking? Like, is it not standing upright, or is the dog standing extremely upright with, you know, tail up and ears up, and like pulling the owner in? Is it like quickly glancing around, right? It's always like, what's going on? What's going on? You know, startling at sudden movement, because that can mean an indication that they're a little nervous, a little scared. You know, I don't, a lot of people, I think, used to talk about things like lip licking and yawning. And, you know, I make note of that, but I think a lot of dogs do that. You know, I think that's a fairly across the board kind of relaxation technique that doesn't necessarily indicate, oh, this dog is really scared, I need to be cautious. I think it's just something to make note of. It is more almost like they are relaxed, like they're willing to do those things. And you can definitely, just like with people, you can kind of imitate what they're doing. So often, like if they yawn, you might want to yawn and kind of be like, oh, this is a relaxed environment, it's okay. I'm also looking, I think a big one that I'm not sure people think about a lot is the retreat. So what I mean by that is, like, a lot of dogs will come out, like if they're under the chair, they're hanging out by their owner, and you first, you know, you sit down, like they might come forward a little bit and sniff, but I'm observing, do they stay out there? Do they want to kind of wander around me while I'm talking? And in the beginning, I'm getting history, right? So I'm mostly focused on the owner. I'm kind of ignoring the animal, the dog, and just letting them investigate. But I'm always observing them, you know, subtly as I'm getting history. But I'm watching, are they coming out and like investigating and then quickly retreating, or are they staying out and investigating the environment? Because I think if they stay out and they're more interactive, that definitely indicates a more confident dog. You know, generally speaking, I'd say a dog that's going to be easier to work with versus the dog that comes out and investigates, but then always is quickly retreating away. Those are going to be a little bit more difficult, and you have to be more careful with how coercive you're being with that dog, because that's the type of dog that, like I said, it'll come out, it will interact, but it's not very happy about the interaction. It's still very worried.
So we have a really interesting question here from Kristen Walter. She would like to know how and when to tell a client that their dog is not a good candidate for rehab in clinic and what you do instead.
Yeah, that's a great question. And I've definitely had those cases. And, Kristen, it's hard to say, like, I don't like have a checkbox of like, okay, they fit like these three things, they shouldn't come in. It's definitely a feeling on my end as well. But I think a lot of it is um that observation of like, are they really scared? Are they retreating? Can I even get in and touch the dog? Because if I can't touch the dog comfortably, like obviously a lot of dogs, we can hold them and get in there and do an exam. But if they are in this state that they are either frozen or they are just ants in their pants trying to get away. They're like, I need to get out of this situation. I don't think those are going to make good rehab candidates. And I think about my staff and I'm like, I don't want to put my staff having to deal with this. One, it's dangerous because while the dog might be freezing for me or flighting for me, in the clinic, they might go to fight and they might actually try and bite someone. And I have a long conversation with the owners too when I recognize this. I do talk to the owners about the impacts of stress and how it's actually not going to be beneficial for the dog to come into the clinic if they're this scared and stressed out. And even if we do get them to do some things, it's probably not going to be as beneficial as we think, because when they're stressed, they've got all these stress hormones going through their body that are not good for healing. And so I don't want to put them in that situation. So oftentimes we talk about a home plan. So definitely therapeutic exercise at home. I also always try to have contacts to people that do treatment at home. So house calls, and it may be that there's someone in the area that does like house call acupuncture and laser. So you can get them set up with that, and you can provide therapeutic exercise and have them come in for checkups. Nowadays, with everything, you can also offer telemedicine consults. That's more what I do than home consults now. I'll set up meetings online so we can go over how everything's going, therapeutic exercises. Usually the dog is comfortable in the house, and so I can see what they're doing and get a good sense of what's going on. And in the rare case, I haven't had a lot of these, but I've had a few where I've actually referred them to a behaviorist first, because I just was like, this is more than just being scared at the vet clinic. This is like generalized anxiety. Like, we need to definitely address this behavioral problem first before we consider doing rehab. Because I think that was, it's a matter of like, I look at what's more important for this dog's life. And the dog was very mobile, like had a good ability, but behaviorally was more affected, like couldn't leave the house without being extremely anxious. And so I was like, yeah, behaviorist first, then rehab. So.
Okay, I like that. Those are some good kind of tools for what we can do in those situations, instead of just saying, I can't actually help you. So for those of you that have joined us, welcome. We are running a competition. You can win a 1-month membership to Online Pet Health. All you have to do is pop in the comments the name of our annual summit, our annual conference, and tag a colleague who you would like to see joining us. So go ahead and do that, and we're going to pick a winner at the end of the chat. And with that, I want to change a little bit of track. So that was really interesting. What are the elements that we need to have kind of like a healthy dog on a behavioral front? Like, what is it that makes a well-balanced, well-behaved dog on an emotional level? Can I say it like that?
Yeah, definitely. Emotions are important. So, I mean, one of the things that I try to incorporate and talk to people about are the 4 steps to behavioral wellness. And this was a concept created by Sarah Strumming of the Cognitive Canine. So you can definitely Google that and look her up, and she's got it all listed out. But what she came up was, and I think it fits really well with rehab because we already do a lot of this. So if we could even take it and incorporate the 4 steps into our rehab practice, I think we'd get the most out of everything we do. But the 4 steps are exercise, which, rehab, enrichment, nutrition, which is also something we spend a lot of time with, and then finally communication. And I really think communication is that big missing step. Like, I think we do a pretty good job with the other 3. I think enrichment we can definitely work with more as well. But we feel well trained in the exercise and nutrition portion, I think. So just making sure we incorporate the other 2 steps, we're going to have a very behaviorally balanced dog.
So what does that communication look like? What does she speak about in that step?
Yeah, so I think communication is a lot about a little bit about what we already touched on. So like observing the dog and trying to interpret what they're communicating to us. So how they're feeling, are they scared? Are they confident? Those kind of things. But then also us being able to communicate back to them what we want. And that's the training process, right? So that's where, we're having to show them, it goes back to like therapeutic exercise too, where they need to understand from us what we want them to do, what they, how we want them to move, what the exercise is. And, so that goes back to, for me, it's pretty much our reinforcement based strategies, but also trying to tell them, I'm not going to force them to do anything either. So, I'm going to try and communicate to them what I would like them to do and try and help them achieve that. But I'm always going to allow them the choice to say, I'm not really into this today. And I think we're really lucky in the rehab sports medicine field that we can do that. Like, it's not like emergency medicine where we really can't give the dogs or any of the animals a choice. I think in rehab medicine, we can take our time and be a little bit more willing to listen to what the animal is communicating to us, and then finding a better way for us to communicate how we can help them to them.
I really love that. So it's really about establishing that two-way communication of responding to what they are telling us or signaling to us or trying to get us to understand, and making sure that we are understood. So that's quite a big thing for me. Like, how do I make myself understood to the dog? What are my intentions? And also, what outcome am I trying to achieve? And that makes me think a little bit of, the different training methods, the different methods that we could use to do that. But before I go into that, we do have a comment here that says, in my practice, I offer so-called doctor or therapist training for dogs. So the dog and owner just practice different situations. I show different devices without using them so that everyone can benefit from them. I love that.
Yeah, that sounds really cool.
Yeah, I think all practices should have that. Like, just general vet practices should have, when the puppies come in for their first vaccinations, come in at X and X and X date and just come into the practice, say hi, get some treats, and go home again. That's just a brilliant idea. Okay, so can we chat a little bit about kind of different training methods that we could use to make ourselves understood or achieve certain outcomes?
Yeah. And I'm just going to put a plug in. Definitely. This is where I go, the training methods, how to do it, in my presentation for the summit. So I'll just briefly kind of mention some of the things. So a lot of what I think we should be doing is reinforcement based. So using something the dog finds reinforcing to get the behavior to happen more, right? So for example, if we want the dog to walk in, get into the underwater treadmill, we want to reinforce that behavior. We want to make it more likely to happen. And often we think of like food or toys as the big reinforcements to get them to do it. But I also want to say that giving the dog a choice actually acts as reinforcement as well. So one of the big techniques I use is kind of like always allowing the retreat and reinforcing the retreat in a way. So if I'm trying, again, as an example, to get the dog to come into the underwater treadmill, I am going to leave everything open. And, if they come up, but I know they're nervous, so say they like touch the ramp, I'm going to have a big celebration, whatever the dog can handle. If they're nervous, a big like, yay, is not going to be reinforcing to them. It actually might be scaring. So being able to like understand that for each dog is important as well. But I'm also going to try and encourage the dog to like go back to the owner or, leave that area as reinforcement as well, so that they realize, okay, this isn't always about like, I just have to like be pushed in there, picked up and put in there, that they actually have this choice to go back and forth. And so often, even when they'll retreat, when they go back to their owner, they go away from where I want them, I'll give them, I'll toss them a treat to, away to them to help them feel like, oh, that was okay. I'm allowed this choice. So I think that's actually been one of the biggest things I think that's helped get the dogs to interact is giving that choice to say, yeah, I don't want to do that right now, or I'm done. And it's not that it's over. It's just they need a break. They're like, okay, I did it. I'm going to go back. And it might be like 5 seconds. And they're like, okay, now I'll try again. Or it might be they are done for the day. And so, yes, it can slow down the process. Like I've had plenty of patients who on their first treatment session, we weren't able to get them into the underwater treadmill. And I think a lot of people would think of that as a failure. But what I see is that then when the dogs do get in the underwater treadmill, and I'm going to say probably 90-95% of them are in by the second time, but they're now more comfortable in there. They're now happy. They're like, okay, this isn't a big deal. And so we actually then make faster progress. And I get more clients that comment on it of like, oh my God, I'm so happy that you guys do it this way and you take your time. I can just tell my dog is so much more comfortable here. And I often say like how much happier they are at the rehab part of the building than, the general vet part of the building. So that always makes my day and the staff's day. Like they want to hear that too. So, yeah, I would say that's a good place to start technique wise.
I really like that. That makes me think of, Robbie Porter's technique where he does like I can't remember. It's a back and forth game. So he throws a treat out and then he reinforces again. So there's a constant back and forth. And I think that gives them a lot of confidence. Yeah.
Yeah. So
sorry.
Yeah, I was gonna say it's loopy training. So and that's another technique that I use. And it's really kind of big in the training world. More and more people are talking about that now, but always trying to create a loop, a behavior loop, so that you can constantly reinforce the dog.
I like it. That one's new to me. So I want to say hi to Sue. Thanks for joining us from Sydney. And she also asks, if you have an overly excited dog, which mine can be as they love vets, do you try to calm them a bit so they don't do everything full on, or do you work with that enthusiasm instead?
It kind of depends what the enthusiasm is about. Like if they're just overly excited, I oftentimes will work with it. Now, I also want to pay attention to, safety. So if I'm doing, an overly excited dog and I'm using fitness equipment, I don't want to take risks that, they may hurt themselves by jumping on the equipment when it's not ready. So definitely preparing the environment for safety when you've got a dog like that. Like, make sure everything that you're not going to be using is out of the way, up, so that the dog can't just run over, because it's happened. They're like, oh, I love this, and they run and they just jump on a peanut, right? And it's not stable and it rolls, and so make sure the environment's set up for safety. And then as long as they're willing to work with that enthusiasm safely, I will work with it. Now, if they are becoming like over aroused, so a little bit too stimulated, then often I will try and calm things down. We might do something like a scatter, where I just have like a search for food on the ground, because often sniffing for things will actually start to relax the brain, or just bring it back down to a normal level of arousal. Patterns are also relaxing. So if we think about like knitting, that's just your hands doing the same pattern over and over, and it's almost like meditating, right? Like, you just get in this state and you relax. And you can do the same thing with dogs. You can do pattern feeding to just kind of help bring things down a little bit. So yes, sometimes I do try and bring the energy level down. It's mostly if I feel like it's not going to be safe with the energy level that they're at. The other thing I often see is sometimes there can be things like overly excited. Maybe actually the dog is frustrated, and so I need to unfrustrate the dog. Like, frustration is not actually a good state to work in, so that's important to kind of be able to differentiate. The other thing is that I would throw in that category that sometimes happens is like a little bit of overexcitement about food. So they're not paying attention to necessarily what's going on. They just want to get at the food. And again, sometimes we'll do a few things to help them relax around the food and help them understand it's not a race to get the food. I will give it to you, but we have to, again, communicate. I want the dog to understand when they are going to get the food. So I help them understand that with a training system.
Okay. I was going to ask about the food, because I often, when I'm doing rehab exercises, so this is kind of a question that I have, is that, like, with cavalettis or with things where I'm specifically trying to get the dog to focus on parts of their body, improve their proprioception in specific ways, I find that the food detracts from that exercise. So all they're focusing on is this, and they're not thinking about what's behind them or under them, or what they're doing. So how do you deal with that?
Yeah, so that's definitely falls 100% into that communication category. So the dog doesn't really understand that there's a time when you just follow the food, and then I will indicate to you when you get the food, versus just like, why are you teasing me with this food in front of me? And I just want it. Why won't you give it to me? And so that's where sometimes, like, we'll talk about luring as being aversive, meaning the dogs don't like it. And that's kind of the situation where they're not paying attention to their body because they just want the food, and they don't understand why you're not giving them the food. And so it just gets more and more and more of them like being like, give me the food, give me the food, give me the food. So setting up a communication system of, okay, you follow the food and then I let you have the food, can often, again, I think it might have to do a little bit with arousal level, but they calm down once they understand the concept. And so then they can follow the food, follow for almost any exercise, and they are still paying attention to their body. And so it's a hot topic right now in the behavior training world, because there's definitely this sort of area where people are like, oh, luring is bad. The dog never learns. And I'm going to say, actually, if they understand luring, if you've communicated it well to them, you can actually be very successful with it. And actually, it can be a fairly quick process. So quick kind of, it's more complicated than this, but the basics of it are having a piece of food in your hand, literally just doing a small, slow lure where the dog follows it, and then actually having some kind of marker that tells the dog, okay, now you can have the food. So if we kind of think like clicker training, a lot of people are familiar with that, and that, you know, when the dog does something correctly, you click and then give them a treat. In the same way, we're going to use a word to indicate to the dog, okay, now you can have the food out of my hand. And so then they start to learn, okay, well, I follow the hand, but I don't get the food until the person says the word. It's similar to like how I call them food robots, but like manners minders or treat and trains, like the dog uses that as a lure. Like they see the machine, when they know that that food comes out of it, they're like, oh, I need to go to that. But again, you notice with all of those types of food robot machines, there's some kind of sound that happens before it releases the food. So it's just using some kind of communicator, some kind of indicator of, okay, now the food is accessible. And I think you can do the same thing with luring.
Okay, I like that. That's very helpful, and it's not something that I thought of before, that I could actually be frustrating or irritating the dog by luring. Not that I'm withholding the food for an excessive amount of time, but it can just feel, yeah, not nice,
Yeah.
right?
Yeah.
Yeah. Okay, that's super cool. All right, so we spoke a little bit about the communication. So let's jump back to the enrichment, which was the other step that we're not, you know, necessarily so well versed on. I think there are many of us who are, but some like me who aren't. So I find it very fascinating that, like, so like, what is canine enrichment? And you hear different catchphrases like environmental enrichment and canine enrichment, and so what are the differences between those?
Yeah. So enrichment is just all about keeping the brain active. And I think a lot of it did come from the zoo world, you know, where we've got these wild animals in enclosed environments, and how can we keep them entertained, for lack of a better word, you know, just, you know, wanting to explore their environment, wanting to interact, and being, you know, mentally healthy. And I think we should be doing the same for our dogs. And I think, you know, definitely it's all encompassing, you know, of their life, but especially when they're recovering from an injury. Because, you know, if we look about, if we think about like the sports dogs, right? They're used to really, really active life, you know, constantly doing things. And now they're recovering from a surgery, and we're like, okay, you get some short leash walks, some gentle weight shifting exercises. You know, it's fairly, like, we would interpret it as boring and that they may be going stir crazy. So I think enrichment is about the brain and keeping it active. And so there's lots of things you can do, and you're probably, most people do have some things that would fall into the enrichment category. You know, we have little tips and tricks that we give owners, you know, for after surgery or when they're supposed to be on restrictions. So it can be as simple as things like stuffing a Kong and freezing it and giving them a Kong to, you know, lick out, chew out, to puzzle toys, so feeding them from a puzzle toy rather than in just an easy bowl, to more complicated things of like teaching them tricks that are safe for them to do despite the fact that they had surgery. So, like, you know, I'll tell them a lot of times, if they're recovering from like a TPLO, and they're in those first 2 weeks, and we've got a sports dog, so they need to be mentally stimulated. I'll tell them, teach them to like put their front arm over their nose, or things that are safe for them to do but take some mental power to figure out and be able to train. But yeah, so it's like there's this whole range from like simple to complicated. A lot of the more simple things have to do with being able to search for food. And I think that's really important, especially when we think about like dogs really are scavengers. And so if we can give them a way to kind of scavenge, that can be very mentally stimulating for them. So I'll do things like scatter feeding in the yard, where just, it's all mixed into the grass and the dog has to sniff and find it. Now they make things called snuffle mats, which are supposed to imitate that. So it's just like little fleece rug things, and you can put the food in there, and they have to snuffle through that to find their food. I've also been, we always have to think about like, what do people have at home that they can, be able to make something that they don't have to go out and buy something. And one of the best things I've come up with is different things for the end of the paper towel roll or the toilet roll, the little cardboard tube things. So they're pretty flexible. So you can put some food in the middle, twist the ends, and now the dog has a puzzle toy that all you have to do is save your toilet paper rolls. If you have a lot of them, my other favorite thing to do is like, when I have 10 or 12 of them, put them upright in a Tupperware container. So, the holes are sticking up, and then sprinkle food in it. So the food all falls to the bottom, and the dog has to figure out how to get down to the food. So, some dogs will just like bite the rolls and like toss them out, and some will shred them. And, it's fun little games that they do, and they have to think about like, how do I get to my food? I also, while it's good for dogs that are recovering, I think those kind of things are good for all dogs. I just think it's a better way to get them their meals than just in a bowl. Make them work for it a little bit.
So we have a comment here: impulse control, something that many owners and dogs do not have, unfortunately. Yes, my empty chocolate wrapper over there says I lack that as well.
Yeah, and I'm going to be maybe a little controversial. I don't like impulse control. I definitely, stimulus control is the learning theory term, where basically meaning that the dogs don't do something until they're told to do it. I think a lot of because I like to use luring, and I think especially in the clinic, to get the dogs to do the behaviors. Oftentimes I'm running into dogs that have been really trained maybe a little bit too much on impulse control, and then they won't lure. Because they're like, oh, this is that game. This is a trick. I'm not supposed to follow the food. And so oftentimes I find those more frustrating. I think it's easier to take a dog that wants the food and is interested in the food and kind of explain to them when they get the food and when they don't, but they still want to follow it. So
yeah, Kristen Walter says she could not live without luring in clinic.
Yeah.
I agree. Yeah, how are we supposed to do those things? I really like Robbie Porter's demonstrations, because there are a few of his webinars in the members portal, and I think it's very clear and very clear and easy to understand how to do it right, because he has the bowl and then the treat, and the dog's coming towards the bowl and the treat comes in the way. So I think that works well.
It's clean mechanics, and it goes back to communication. And it didn't even pop up into my head, but that's another way we communicate with the dog. It's if we have clean mechanics with everything we do, then the dog understands it. And I think part of it is because we're such a verbal species that we want to just talk, and we want the dog to understand. And really what our communication is through our movement and our mechanics. And so if we clean up our mechanics, they actually understand and then learn faster and get what we want them to do faster.
Kristen says, how do you separate luring from coercion? And I think that's a very good question.
Yeah, so a lot of it is, it's reading the dog's body language while you're luring. So a lot of times, and this is one of the things that I probably do without necessarily realizing it when I'm meeting with the dog for the first time, so that I can help my staff understand. So if I try to lure the dog and I see like the dog wants to follow, but their body language is stiff, or they're just doing that like lean, like stretch, we've all seen those dogs do it. They're like, I'm not going to move my legs. I'm just going to stretch my neck out as far as I can to try and get that treat. And then they get that treat and they immediately like pop back, right? They're like, okay, now I'm going to get as far away from you as possible. That's where I think you understand, you can see like, oh, this is coercive. Like the dog is hungry. They want the food, but they do not want to do what you're asking them to do. And so I see that a lot too with like getting in the treadmill, where you'll put cookies as like a cookie trail, and the dog is like, I really want that next one, but they're not going to take that step to get it. They're just going to reach forward as far as they can. And as soon as they get it, they back off. And so that's where I'm like, okay, we can use food to our advantage, but we need to be careful with it, because there's definitely like, we're right on that line of being a little too coercive. And so that's where I think the biggest thing is you have to break up the steps. You have to find where the dog is comfortable and what you can work with, and then try and build from there. So a lot of times those dogs that are finding the luring coercive, I will try and find something that they are happy to do for the food, excited to do. So even though I may be trying to get them into the underwater treadmill, it now may become, okay, I'm going to ask the dog for a sit. And if they offer a sit, they get food. So we change the communication system a little bit. Rather than using like a luring communication system, now I'll go into more of like, I'm going to ask you for something that your owner has told me you know how to do, and then give you food for that. So you can see that I'm not always trying to like bribe you or make you do something you don't really want to do to get the food. I can also give you food for doing things that you do want to do.
Okay, I like that. My brain is ticking very fast, trying to see where we're going to go next. I love this. Okay. So I think that one of the other questions that I have about for example, patients that are on bed rest or crate rest or recovery or whatever the case may be, is that enough? Like, is it enough to just have them play puzzle games when these dogs are used to going on like a lot of physical activity, not necessarily a lot of brain work? Is that switch over to lots of brain work enough for them?
It's hard to know for sure, but I think I think it's satisfying. I think is a better way to think about it, rather than is it enough? Because they do, like, brain work is hard. So if you found something that's sufficiently challenging, yes, I think they can show that it's satisfying to do it. I think it's, and then they're more relaxed, they sleep, all these other things that we're looking for to kind of indicate that they're doing okay. As they are recovering more, I'm always trying to add more things in that they're physically capable to do. So a lot of times, as soon as, like, for example, if it's surgery, as soon as they get past that, like, 10 to 14 day window of recovering right after surgery, I will start encouraging them to do things like nose work or tracking, things that are basically the same as walking, which they're now, allowed to do for short periods of time, and combining that with some brain stimulation. And the thing is, like, we say like nose work and tracking, and I think, like, in my head it immediately goes to, well, that takes a long time. And it doesn't really. Like, I did tracking with my dog after it was recovering from surgery, and basically it took me longer to get to the park to set the and longer to set the track than actual tracking itself. The actual running the track was maybe like a minute, 2 minutes. So, if I was on 5-minute leash walks, I still had 3 more minutes that I could then take the dog for more of a leash walk. So you can do things like that pretty easily, and it totally stimulates them. I mean, this was my example, my personal example. This was, like a 6, 7, 8-month-old border collie, and literally these, 2-3 minute tracks were enough for him to be completely stimulated, satisfied. He would go home and be like, okay, I can sleep now. And this is a dog who now, at over 2 years old, wants to run and run and run for miles and, like, never seems tired. But, doing the tracking was plenty for him.
Yeah. Kristen says, I think it's usually harder for the clients.
Yeah.
I agree. Yeah.
I think we all do, like, we feel sorry for them. We're like, oh, poor baby, but I think there are things we can help them do, but a lot of it does come more from a training side. And so I think sometimes as vets, we don't necessarily feel comfortable giving that training advice and, like, how to do things. And so again, this is a place where, like, reaching out, finding some local resources for yourself, like find someone nearby who teaches nose work class and have their card so you can refer people out to that. Around here, we have people who teach truffle hunting, and I think that's a great exercise for after recovering from surgery or injury, because it's just like a combination of nose work and tracking, where the dog has to, like, take you around a cool place, and they're finding fun things, truffles. Someone commented that there was another puzzle is with a wine cork, and you put many of the corks in a large tupper, sprinkle in the food, and off you go. The dog has to dig out through the corks to find all the food. And yeah, that's great. That's a lot like my toilet rolls in the Tupperware. So I love all these, like, puzzle toys, and you can come up with so many things. Like, one of the things I also do is I try and save my cardboard boxes and packing paper and stuff when it comes for deliveries. And you can stuff all the paper in the boxes, sprinkle a bit of food in there for them to search for, and they dig in there, rip up the paper. I've had other clients do, say, like, the dog is their mail shredder. So, they just give all the junk mail to the dog and have the dog shred all the junk mail up as enrichment. So there's lots of things that you can do to help keep that brain active that the dogs love and aren't going to, like, mess up your furniture or be super complicated. So
before we end off, I have one more question, just a fun one. So I want to know, we often hear, like, about these quirky things that are, like, breed specific. And I think that that's even more common in sports medicine, in competition dogs. So I want to know about some of the quirky behaviors or characteristics or tendencies that maybe some breeds in some sports have.
I think so. It's tough. I think a lot of them are a bit like obsessive, and I'm gonna say it's probably more so the border collies than anything, but that is kind of my breed, so I know a little bit more about their quirkiness, because I think most people like try and hide it when they're outside of the house. But I think like little obsessive tendencies, light chasing is definitely a big one that you probably will see more in the clinic, because like if you have windows or sunlight kind of coming into the clinic, you'll get these dogs that will like chase shadows, and if you haven't seen it, it can be a little weird. So that's probably the biggest thing I can think of. I would say the other thing that sort of goes along with this question, but I always find interesting, is a lot of sports dogs aren't necessarily well trained in like basic pet dog behaviors, because a lot of them aren't needed for their sport, and like specifically agility. I think about it. A lot of agility dogs do not walk nicely on a leash. And so a lot of times I think the biggest struggle I find with sport dog owners is when we say, okay, now you can start your leash walks. And they're like, oh no, leash walks are bad. Like leash walks are probably going to be worse. And so you definitely have to talk to the owner about that. And I often spend a lot of times with like, okay, how is this dog on a leash? Like, does the dog pull you down the street? Because that's not what I want. If we're 2 weeks post-op, that's not the type of leash walking that I want. So we also often have to have a dialogue about, okay, how can we figure out our walking plan? Because these dogs, they're not used to being on leash. So then when you suddenly have them on leash, it's not good. Again, going back to my own dog, walking him on leash at 7, 8 months old when he was recovering from surgery was actually the worst thing I could do for him, because as soon as I put the leash on, he just jumped up and down and basically was jumping as high as my head. And I was like, yeah, that's not so good for your joints that are recovering. So things like, talking about long line uses, and even potentially walking them off leash, even though that sounds scary, often these dogs are better behaved off leash because that's what they're used to. So
that's an interesting thought, and one that I didn't know. I like, yeah. I mean, mine is the same. She just, the moment the lead comes out, she just starts jumping into the air. So I can see that being a problem.
Yeah.
Leslie, thank you so much for your time, and thank you to everyone who's watching and participating. We've had some beautiful questions, so thank you so much.
Thank you.
Have a wonderful day. Bye.
Bye.